Welcome to Ulosca channel. Access all nursing practice questions. Pharmacology 2 nursing practice questions with answers.
Question 1. A patient taking warfarin should avoid excessive intake of which vitamin due to its effect on anticoagulation? A. Vitamin C. B. Vitamin K. C. Vitamin D. D. Vitamin B12. Which one is the correct answer? The correct answer is B. Vitamin K. Explanation. Vitamin K plays a crucial role in the synthesis of clotting factors in the liver. Warfarin works by inhibiting vitamin K-dependent clotting factors. If a patient consumes too much vitamin K, it can reduce the effectiveness of warfarin and increase the risk of clot formation. Question 2. What is the antidote for opioid overdose? A. Flumazenol. B. Naloxone. C. Protamine sulfate. D. Atropine. Which one is the correct answer? The correct answer is B. Naloxone. Explanation. Naloxone is an opioid antagonist that rapidly binds to opioid receptors and displaces opioids, reversing their effects. It is used in emergency situations for opioid overdose, especially when respiratory depression is present. Question 3. A nurse is administering digoxin. Which of the following should be assessed prior to administration? A. Blood glucose level. B. Respiratory rate. C. Blood pressure. D. Apical pulse for 1 full minute. Which one is the correct answer? The correct answer is D. Apical pulse for 1 full minute. Explanation. Digoxin can slow the heart rate. To prevent bradycardia, nurses must assess the apical pulse for 1 full minute before administration. If the pulse is below 60 bpm, the medication should be held and the provider notified. Question 4. Which of the following is a common side effect of furosemide? A. Hyperkalemia. B. Constipation. C. Hypokalemia. D. Bradycardia. Which one is the correct answer? The correct answer is C. Hypokalemia. Explanation. Furosemide is a loop diuretic that increases urine output and causes the loss of electrolytes, especially potassium. Hypokalemia can lead to muscle weakness, cramping, and cardiac arrhythmias, so monitoring is essential. Question 5. A patient prescribed gentamicin should be monitored for which adverse effect? A. Hepatotoxicity. B. Ototoxicity. C. Dry mouth. D. Hypotension. Which one is the correct answer? The correct answer is B. Ototoxicity. Explanation. Gentamicin is known to be ototoxic, meaning it can damage the inner ear. Patients should be monitored for signs such as tinnitus, hearing loss, and balance disturbances. This effect is more common with high doses or prolonged use. Question 6. What is the therapeutic use of albuterol? A. Treat hypertension. B. Relieve bronchospasm and asthma. C. Control heart rate. D. Reduce fever. Which one is the correct answer? The correct answer is B. Relieve bronchospasm and asthma. Explanation. Albuterol is a short-acting beta-2 adrenergic agonist that causes bronchodilation. It relaxes the smooth muscle in the airways, making it easier to breathe. It is commonly used for quick relief during asthma attacks or in COPD flare-ups. Question 7. A patient taking lisinopril should be monitored for which potential side effect? A. Constipation. B. Cough. C. Weight gain. D. Hyperglycemia. Which one is the correct answer? The correct answer is B. Cough. Explanation: lisinopril, an ACE inhibitor, commonly causes a dry, persistent cough due to the accumulation of bradykinin. While not dangerous, it can be bothersome enough to require switching to another class of antihypertensives like ARBs. Question 8. Which statement indicates the patient understands the use of nitroglycerin sublingual tablets? A. I should swallow the tablet with water. B. I will place the tablet under my tongue and let it dissolve. C. I will chew the tablet for faster action. D. I will store it in a humid place. Which one is the correct answer? The correct answer is B. I will place the tablet under my tongue and let it dissolve. Explanation: sublingual nitroglycerin is absorbed quickly through the oral mucosa when placed under the tongue, allowing for rapid relief of chest pain. Swallowing or chewing the tablet reduces its effectiveness. It should also be stored in a cool, dry place. Question 9. Which of the following medications is classified as a beta blocker? A. Enalapril. B. Furosemide. C. Metoprolol. D. Losartan. Which one is the correct answer? The correct answer is C. Metoprolol. Explanation: metoprolol is a selective beta-1 blocker that reduces heart rate, cardiac output, and blood pressure. It is used in conditions like hypertension, angina, and heart failure. Beta blockers also reduce the risk of heart attacks. Question 10. What lab value should be monitored in a patient receiving heparin therapy? A. INR. B. Hematocrit. C. APTT. D. Potassium. Which one is the correct answer? The correct answer is C. APTT. Explanation: activated partial thromboplastin time is the primary lab test to monitor heparin effectiveness. It helps determine whether the blood is clotting within the desired therapeutic range to prevent both clotting and bleeding complications.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.